Hello, bonjour. Welcome to the first in a series of webinars on mental health and performing artists during the COVID-19 pandemic. I'm Lynda Mainwaring, psychologist, professor, and long-standing member of the IADAMS Association, and your co-host today. These webinar recordings have been made available through a mental health working group arising from the International Association for Dance Medicine and Science. Today, we hope to provide mental health tips and explore mental health issues that may arise from the consequences of the global crisis and promote resiliency in the face of these difficult times. The technical information for today, these recordings will be made available on the IADAMS website and also on the IADAMS YouTube station, and we'll provide those later. You may also be able to access these from the IADAMS conference app. So today we have an impressive group of professionals joining us, Doctors Nancy Kadel, Dr. Bonnie Robson, and Dr. Paula Thomson. And my co-host today is Peter Lewton-Brain, the current president of the International Association for Dance Medicine and Science. Peter was the inspiration for this webinar series and the motivator for the working group. And I'm very pleased to introduce my co-host, Mr. Peter Lewton-Brain. He is a dancer, an osteopath, a dance teacher, and as I said, the current president of the International Association for Dance Medicine and Science. So welcome, Peter. Thank you for your inspiration. And could you please give us an idea of what it was that gave you this motivation to start this working group and your identification of the needs of professional and pre-professional dancers today. So welcome, Peter, and thank you.
Thank you, Lynda. This idea started the day the ballet I worked for, the Ballet de Monte Carlo, closed down. We'd been working all day, and at the end of the day, we were told everything was closed and everyone should go home. And I saw the faces of the dancers that just seemed emptied. And this vision kept coming back to me over the days and the week that followed. There'd been dancers one day and suddenly they were, sort of basically locked up at home. And being an osteopath, where the basis of the osteopathy is, mind, matter, and movement and motion, mind, matter, and motion. And that's what dancers are doing. They don't just dance with movement, it's also their spirit and their bodies. So some of their bodies cannot move and their spirits are sort of thrashed. A dancer who's not dancing, as Balanchine rather sadly said, a dancer who does not dance does not exist. So it was almost like an existential question that suddenly these dancers don't feel like they're dancing. And I realized there's no dancers, there's no studios, there's no companies, there's no performances, and suddenly there's no future for them, there's no present even. And this notion kept coming back, and this notion of their faces just emptied, and seeing our dancers, some of them very isolated, I realized this is not a place for physical medicine, it's a place for mental health professionals, and this is not my domain. So luckily within IADAMS, we have wonderful people like yourselves here. So I reached out to Paula and Bonnie and Lynda and started to speak to them and think, what can we do? Because this, I think, is a crisis situation that has to be dealt with. Many of the dancers in the beginning were just in a bit of shock. And then, when you had the death of Willie Berman, a professor who'd worked with the company a great deal, it sort of hit them, and this shock started going to different stages. And I really realized this is time to move on to professionals in this domain. So I thank you all for being here, and I greatly appreciate it.
And thank you, Peter, for your insights and your leadership to bring us all together at this very important time. We're very grateful for you for starting this initiative. Today, we're going to answer the question, how is COVID-19 affecting dancers, pre-professional dancers, student dancers, professionals, multidisciplinary professionals in IADAMS? And hopefully we'll be able to provide you with some strategies to help you with some really great information from our professionals today. At this time, I'd like to introduce Dr. Paula Thomson, who's a clinical psychologist, professor, dancer, choreographer, and a real contributor to our working group. Thank you, Paula, for being here today. And I'd like to ask you what your perspective is on the current situation and the stressors that are affecting dancers.
Thank you, Lynda, and thank you, Peter, and to all of the members on this task force. First of all, Peter, you're absolutely correct. Dancers, when they're not dancing, they wonder if they exist. And that existential question, I think, is pervasive around the world. What is our world now? How do we exist in this world that has changed so radically? And our naivete that we are immune to pandemics has forever gone. So dancers are acutely aware of this because of their lived experience along with the rest of the world. So given that, there's been a lot of talk about trauma, about the long-term effects of PTSD and how that's going to affect our humanity. And I thought I would take a slightly different angle and look at it through the attachment lens. Because when we're little, when we're babies, we have primary attachment figures. And through those interactions, we build a sense of self, a sense of other, and a sense of the world. And that internal working model is either that we are safe, we are secure, and all will work out, or we're anxious and we're not sure that it's going to work out. Regardless of that attachment experience, dancers who are incredibly uniquely situated, early on, they feel that urge to move, to dance, to express. That is also part of their identity. So they form an attachment relationship with their own talent, not just with other people, but with themselves as dancers. And when they go into the dance community, they literally are with other dancers, other selves, and they co-create this expressive art form that we all love and cherish. So when you lose that, you lose a sense of self, you lose a sense of other, and you lose a sense of the world. That initial separation causes intense protest. Small babies will cry and protest, they don't like it. Adults, we aren't too much different, we don't like it. So I know initially when we were told, okay, we've got to close down the dance program at the university, I didn't believe it. I thought, are you crazy? No, we have to keep coming to class. We got a show coming up. So that protest sat there for a good while, and it's healthy. And then comes the despair. After time, you just feel like, oh, maybe it's not going to happen the way I had imagined. My protest isn't working. You keep searching, but you're despairing. And then if enough time goes by, you start to withdraw. And that withdrawal, it seems like you don't care, but your energy is way lower. And that's where many of us are finding ourselves now, is we're withdrawing a bit. We're reaching out, we're connecting, but not the same way. When we were in despair, we had anger, we had depression, we had sadness. Now we're a little bit numb. It's like, oh, what's going to happen? The good news is it also goes in the reverse direction. When we open up, we get to go back and protest and insist that we be given funds, that we get back into the studio, that we have to train, we have to do all these things so that we can repair the rupture. And that repair of rupture is what gives us our survival instinct. Attachment is deeply biological and it's deeply survival rooted. So I thought rather than framing it as trauma model, if we look at it as attachment, yeah, we can repair. And the good thing in the PTSD research is some people through a crisis show no problems. They stay steady across the board. Others who are considered more in that resilient category dip down, they show the effects of stress, and then they recover. And then there's a third group, and that's our concern group. They show significant despair and distress, and they actually become vulnerable to more pathology. So that's the group that we are worried about most, is to help those more fragile people so they can rekindle and regroup as dancers. So yes, we have a deep survival. The dancers dance in their soul and their spirit, and I have every confidence that we will return, but this is normal to feel what we're feeling. So thank you.
Thank you very much, Paula. Those are very, very important concepts and issues that you described. And I think we're all feeling anxious today. And on top of the layer of performance and connectivity for the dancers, we've got the layer of anxiety that we're all facing of not just being able to dance and go to the studio, but not being able to socialize with our families, our loved ones, those people that are very important to us, not even being able to go grocery shopping in the same way. So this is an unprecedented time with many, many layers of stressors. And I think your comment about this is normal ways for us all to be feeling, but there are some things that we can do. And this group is going to help all of you with some of those strategies, because Peter suggested in the beginning when we started with this working group that we're going to try and help all of you help yourselves, because that's a really important thing for us to get back on track. So thank you for those very important words of wisdom, Dr. Thomson. And now I'd like to introduce Dr. Nancy Kadel, who is an orthopedic surgeon, a former dancer, and a great leader in the performing arts medicine world, and the past president of the Performing Arts Medicine Association. Dr. Kadel, welcome today, and thank you for being here. And I was wondering if you could provide some perspective for us of the kinds of issues that you may be seeing with some of the dancers and athletes that you might be treating. Thank you. Welcome.
Thank you very much. It's really wonderful to hear from these experts, because I certainly don't have that expertise in mental health, but I do know that I've seen many of my dancer patients struggling to recover from their injuries in these strange and very stressful times. I know that we've had to switch from in-person visits to video visits, and video visits with their physical therapist. And I think that in addition to just the fact that they have an injury, they're facing canceled seasons and uncertainty about the future, like all of us have. Sadly, we have several of my patients and dancers that I know well that are retiring this year, and the season was canceled, so they don't even get that opportunity to say goodbye, nor do we get the opportunity to celebrate their career. And so that's been sad. I feel sad that we can't honor those dancers that in the way that we want to. But I was also thinking about my other patients, and I take care of a lot of athletes. And I worry about mental health resources, in particular for my dancer patients. Certainly in the world of sports medicine, we have long understood the value of mental health support for performance as well as healing injuries. Certainly, Peter spoke about the mind-body connection, and we know that that's important in healing. So the professional rugby players that I take care of, for example, they have a team psychologist on the sidelines at every match. They also have access to performance coaches and mental health coaches, and there's no stigma associated with seeking mental health care. But I feel that for my dancers, there's a little more of a stigma, and it might be seen as a weakness to ask for mental health care. And I'm hoping that this fabulous group of experts we have today can help dancers feel that there are positive things that mental health can do for them, and it can actually help with their healing from injuries as well as healing their spirit. I do know that for all my patients, a surgical patient or not, there is a big importance of the mind-body connection, especially with regards to healing and returning to full performance. But I would say that on a positive note with my dancer patients, I've been trying to help them view this strange time as maybe a rare gift. It's an opportunity for them to slow down, to take some time to maybe let those chronic, smaller overuse injuries actually heal. Because even if they're working out in their kitchen, they're still not at that same level of exercise and stress on the body that they would be with daily studio work and performances. So I asked them to say, maybe you can work with your physical therapist. And believe me, these dancers are very creative. And so they can work on video with the physical therapist and adjust the camera so that they can see what they're doing. And we've had some really positive interactions where the therapists have helped them work on small muscle imbalances or subtle weaknesses, or maybe even some poor biomechanics that might be contributing to overuse injuries, or at least to optimize their healing from the injury they've had. And rarely do they get this gift of time where they really can focus on some of those things that they just never have time to completely focus on. So I hope that they can find some positive aspects in this. For me, positive, I'm learning computer skills and how to have video conferences with my patients. So that's been really helpful. So thank you, and I'll give it back to you, Lynda.
Thank you very much, Dr. Kadel. You know, I think you mentioned some really significant aspects of what we're coping with, what we're trying to deal with, especially for all of us, but especially for the performing artists, and that is the sense of loss. And I know Dr. Robson mentioned this earlier in one of our meetings, and perhaps she'll contribute a little more shortly, but that sense of loss of not being able to socialize, not being able to acknowledge and honor what we've done and what others are doing, it's a great loss. When we lose somebody in death, there's a grieving process, and we often forget that when we lose functioning and we lose aspects of our social lives, that is a loss for us as well, and we're all dealing with those very difficult times. And also, I really enjoyed what you said about using this time wisely and effectively. Yes, we have to manage and work with our current stressors and try to provide ourselves with some solace and calming, but we also can do some very productive work. As a performance psychologist, I often try and help people prepare for their upcoming performances or their athletic games. And this is a really great time to do that mental rehearsal, to do that work, and to strategize, to plan, to do your mental rehearsals. I'll just point out that mental rehearsal, that your brain is actually firing the musculature, the neuromuscular patterning when you're doing mental rehearsal. So that is one thing, and we'll have a webinar on that upcoming. So thank you so much for your very wise and insightful comments today. And now I'd like to turn to Dr. Bonnie Robson, who is a psychiatrist, retired, but has been a researcher and consultant to the performing arts world for over 40 years. Maybe I shouldn't say that, Bonnie, but you have been a long-standing member of many associations and provided us with some wonderful talks and some wonderful consultations with our collaborations. And you've been working in particular with dancers and professional dancers. And now I'd like you to provide us with some of your insights with how COVID-19 and this situation is affecting dancers and affecting all of us, and maybe how we might cope a little bit better. So Dr. Bonnie Robson, welcome.
Thank you very much. What a privilege it is to be here. And I'm talking, of course, to the dancers who are elite athletes, and they're resilient. After all, they have survived training for 10,000 hours to obtain the stature that they have. So while dancers, you're in physical isolation, you're not in social isolation. And you've already recognized that you can reach out and connect with family and friends. We've had a couple of weeks now to try these things out. In fact, some of the dancers are telling me that they're overwhelmed with the social interaction, and they're bombarded by, and they're having to spend a lot more time on their emails. And so I want to talk to that aspect of physical health, which leads to good mental health, which leads to psychological skills training. And many of the people that we're talking to today have some psychological skills training in their training. They may have forgotten that they have it, but it's there and you can resource it now. One of the most important things is routine. Bodies love routine. So as Paula Thomson said, if you want to move, you've got to move. So you've got to figure out how you can meet that need for you. So bodies like regulation, they like scheduling, they like routine too. You function well if you're in a routine. So the most important routine that we have is our sleep-wake cycle. And please, let's remember that. We mustn't disturb that sleep-wake cycle. And even if it is disturbed, and let's say you wake up in the night because we're all nervous and withdrawn and feeling a little funny, don't resist, please, the temptation to nap too much in the day. Naps are fine. We'll talk more about sleep at a later date. But for now, the routine is what I think we all need to feel comfortable. And to echo Dr. Paula Thomson, where she said, we're attached to a routine, to a normal thing. People are biased to the familiar. And if you do the normal thing, it feels more comfortable. You know how, dancers know how it feels to put that hand on the bar and do that first plie. When dancers in New York City experienced 9/11, one of the most comforting things for them was to return to the studio and put that hand on the bar. So we want to continue exercise. Some people are using the opportunity to try new things, some yoga, some Pilates, some mindfulness and breathing exercises, and that's really great. But be cautious about taking on, I'm sure Dr. Kadel will tell us that, on a new stretching or especially a static stretching exercise that you've never taken on before. We don't want any injuries at this time. So be safe. And a New York City dietitian has said to me that she wants us to eat healthy. If the dancers were eating like 6 meals a day in healthy progression, then you should also now follow the same pattern, the same routine. Routine is going to be good for you. It's going to feel familiar. If you ate just 3 meals, follow that. Many people you've noticed are already posting their healthy meals on their Facebook page, so we can all see that, and that's great. As we think about psychological skills, I want you to think about one. We can all name the difficulties that we've had, all the things that you could make a long list, and then you could tear it up if you wanted. We don't need that list. What we want is to think about, with gratitude, the things we do have and the things that we're sharing together. And finally, I'd like to remind you about your safe place. And we'll practice that too at times, but we all can imagine today a safe place where we can go or where we may have been. And we can bring that safe place up anytime we're feeling withdrawn, depressed, and just take a few minutes and think about going to that safe place and being safe. And I think maybe doing that a couple of times a day, and then you can use your breathing and your mindfulness practice that you've learned to increase your feeling of comfort with yourself. Thank you.
Thank you so much, Bonnie, for those words of wisdom. And I think recognizing that these days are very difficult, and we've been thrown into chaos and into a very big change situation, and change is always stressful in itself. And so trying to maintain some sort of routine is very important for us. And if we can do that with our sleep cycle, our nutrition, and our ways, social connections, then we're going to fare a little bit better, not throwing ourselves into a complete disarray, because it's easy to fall into those situations when we're not having the anchors in our lifestyle and the things that we are used to doing, those familiar things like hanging onto the bar, connecting with other ones. And you're right, there's been so much reaching out from many domains. We're all trying to help each other, and the social connections and the dances that people and the musicianship that has been put forth on the web are all ways that we are connecting. It's not the same as a biophysical connection, but it is a social connection that is so very important. And so that's one way that we can cope. So the routine is important, the mindfulness, those practices, and we're going to help you through these webinars, maybe gain some of those and strengthen some of the skills that you already have. And we know very much that practical skills, dancers are very good at moving, and we want to get some practical strategies into your hands, and we will do that at a future time. So now I'd like to wrap things up a little bit by, first of all, briefly summarizing all these wonderful tips and insights that we've had about attachment, losing our familiar, losing our sense of physical prowess, losing our social connections. Being stressed and being anxious is a normal thing for us to feel. And I'm wondering, Dr. Thomson, you mentioned normalization. If you could just provide us with a small strategy or insight about what you mean, that it's normal to feel like this.
Yeah, and I'm going to talk directly to a dancer mind. You're not going to get it perfect through all of this, so you're going to mess up on some of these things, and that's perfectly normal. You may feel disorganized, your sleep, your eating, you may gain, as my husband says, the COVID-19 pounds. We don't know. This is all uncharted territory, so have some self-compassion and be kind to yourself, because we are in a disorganized and disorienting situation, all of us, and it's okay. And truthfully, that is where creativity springs from. So you are creative beings, and that disorganization allows for reorganization in a new paradigm. Our desire to endure and to perform and to dance is always there when we turn to it. You may withdraw for a long while. I know dancers who retire don't want to go and see dance performances, and then little by little they want to go back. Or they say, oh, I'm not a dancer now, I've quit, I did that. And then you realize, oh, I really can't quit, my body hurts too much, I better go back to class. So dance doesn't leave us, even though things change. And for us to be willing to allow that change to happen and stay creatively engaged as we do this transition together. So that's pretty much where I'm leaving it. There's lots of strategies, but it doesn't matter in the end. Compassion.
Thank you so much. That's a very important point. Self-care, self-compassion, so that you can look after yourself and look after your loved ones is so very important. And there's a theory that says out of chaos comes clarity. And there's also a great body of research that shows that there is growth after trauma and after difficulty. And I think we're all going to come out of this stronger. Yes, there are going to be some scars, and we're not going to get everything right. And there's lots of losses, but we're here to help you, which is why we've launched these webinars. And we're going to do our best to provide some practical strategies and some insights from all the years of training that we've all had. And that probably amounts to over 100 years of training when we're looking at everybody here. And so I'd like to ask my co-host, Mr. Peter Lewton-Brain, the president of IADAMS, if he has any last words. I know you're a PhD candidate, so I was anticipating that doctorate is coming along very quickly. I'm wondering if you could provide us with any insights about what you're seeing and what we've said today, and just kind of end on that note, and then I'll announce our next webinar. So Peter, have you got a final thought for us?
Thank you, Lynda. First of all, I just feel terribly honored to lead an organization which has people such as you who can contribute and reach out and share these wonderful insights with dancers. Just the whole notion that, you know, health is the physical and mental and social well-being. And I think this whole situation is reminding us there's more than the physical, it's the mental and the social, and that unity of these things is what really allows us to dance and perform and exchange with an audience and with each other. So I'd just like to honor that, and thank you again all for being here and for contributing.
Thank you very much. And thank you again, Peter, for starting this initiative. I think it's critical, it's very important. And thank you to all of you for being such wonderful colleagues. And I know working hours late and long to try and put some ideas together for our membership and for our dancers and for people out in the community, for the public. So thank you to you all for joining us today on this webinar. And we look forward to seeing you next time for our second webinar, which will be a webinar on exploring emotional experiences during this COVID-19 crisis. And we look forward to seeing you. And thank you so much for joining us this day. Be well, be safe, be creative. Thank you. Goodbye, everybody.